Good day everyone. Today we will be discussing about the drug named Tacrolimus. Tacrolimus comes under the pharmacological category of immunosuppressants. The mechanism of action of tacrolimus in atopic dermatitis is not known. While the following have been observed, the clinical significance of these observations in atopic dermatitis is not known. It has been demonstrated that tacrolimus inhibits T lymphocyte activation by first binding to an intracellular protein, FKBP12. A complex of tacrolimus FKBP12, calcium, calmodulin, and calcineurin is then formed and the phosphatase activity of calcineurin is inhibited. This prevents the dephosphorylation and translocation of nuclear factor of activated T cells, a nuclear component thought to initiate gene transcription for the formation of lymphokines. Tacrolimus also inhibits the transcription for genes which encode IL-3, IL-4, IL-5, GM-CSF, and TNF, all of which are involved in the early stages of T-cell activation. Additionally, tacrolimus has been shown to inhibit the release of preformed mediators from skin mast cells and basophils. Tacrolimus is an immunosuppressive agent used for prophylaxis of organ rejection post-transplant. Tacrolimus use is in combination with one or, most commonly, two other immunosuppressive medications. It has an application as an agent for the prevention or treatment of certain autoimmune diseases. In solid organ transplantation, it serves as the treatment of organ rejection in kidney, liver, and heart allogeneic transplants. There is also an off-label indication for the prevention of rejection in lung transplant patients. Other off-label indications include Crohn's disease, graft versus host disease, myasthenia gravis, rheumatoid arthritis. Tacrolimus indications also include topical use in moderate to severe atopic dermatitis, as well as other off-label dermatologic disease states. Adverse effects include diabetes mellitus, drug-induced thrombotic microangiopathy, hyperkalemia, hypertension, infection, malignancy, nephrotoxicity, neurotoxicity, pure red cell aplasia. Contraindications to tacrolimus include hypersensitivity, polyoxal 6-dehydrogenated castor oil or other components of the formulation. Tacrolimus is a narrow therapeutic index drug. Therapeutic monitoring of tacrolimus in transplant patients is a valuable tool in adjusting drug levels. Since tacrolimus use is typically in combination with other immunosuppressants, target levels usually decrease as post-transplant time increases to minimize calcineurin inhibitor-mediated nephrotoxicity and adverse effects. Whole blood concentrations should be used, drawn typically within 30 minutes before the next dose. Monitoring parameters include renal function, hepatic function, serum electrolytes, glucose, and blood pressure. Parameters should initially be measured 2 to 3 times a week post-operatively, gradually decreasing as time passes, achieving target levels, and patient stabilization.
Thank you. Kindly comment for further queries and doubts.